Rovier's node are situated in retropharynx. Passants is formed by palatopharyngeus. Crystalline lens develops from surface ectoderm. Muscle entering middle ear from pyramid apex knee apex is stapedius. Eustachian tube passes between above superior constrictor. Largest turbinate is inferior turbinate. Nasolacrimal duct opens into the inferior meatus. Which of the following is the direct content of the cavernous sinus, abducent nerve, which is not a characteristic of a typical cervical vertebrae, has a large vertebral body? So, what are the characteristics of typical cervical vertebrae? It has a triangular vertebral canal, has foramen transversarium, superior articular facet is directed backward and upward. Waldeyer ring consists of all of the following except post-auricular node. It consists of palatine tonsil, pharyngeal tonsil, and tubal tonsil. Gillet's space indicate which of the following: retropharyngeal space. Mandibular nerve exits the cranial cavity by passing through foramen ovale. Which of the following is related to the floor of middle ear? Internal jugular vein. Nasolacrimal duct opens into inferior meatus. Suture present between parietal and occipital bone is lambdoid suture. Surface anatomy for internal jugular vein is ear lobule to medial third of clavicle. Abductor of vocal cord is posterior cricoarytenoid. Otic ganglia is related to ninth nerve. Posterior one-third of the tongue develops from hypobranchial eminence. Trapezoid body is seen in lateral lemniscus pathway. Which of the suprahyoid muscle is supplied by both facial nerve and mandibular nerve? Digastric. What is present in the retropharyngeal space? Loose areolar tissue and lymph node. Anterior one-third of the tongue develops from which arch? First, Killian dehiscence is an inferior constrictor. Sensory supply of larynx below the vocal cord is by recurrent laryngeal nerve. All of the following are true about the ear ossicle except the muscles are highly developed like in bats for echolocation. So what is true about ear ossicle? It gives the eardrum mechanical advantage via lever action, transmit vibration from tympanic membrane to inner ear, and it is controlled by muscles as part of the acoustic reflex. Sphenoid sinus drains into which of the following? Sphenoethmoidal recess. Ethmoid articulates with which of the following? Inferior turbinate. Cranial nerve 8th exits through which of the following? Internal acoustic meatus. Ethmoidal sinus opens into which of the following? Hiatus semilunaris, middle meatus, and superior meatus. Yoke muscle repair right LR plus left MR. Choroidal artery is a branch of which of the following? Internal carotid artery. Chamberlain's line is palate to foramen magnum. Ear ossicle articulate with each other through which type of joint? Synovial. All of the following are true about the larynx except all intrinsic muscle are supplied by the recurrent laryngeal nerve. So what is true about larynx? Cricothyroid is supplied by the external laryngeal nerve. Posterior cricoarytenoid abduct the vocal cord. Lymphatic drainage of the larynx is to the deep cervical node. All of the following are true about the middle ear cavity except medial wall is formed by tympanic membrane. So what is true about the middle ear cavity? Roof is formed by tegment tympani. Anterior wall has opening of two canal and floor has bulb of internal jugular vein. Inferior thyroid artery arises from which of the following vessels? Thyrocervical trunk. Nerve to pterygoid canal is formed from deep petrosal nerve plus greater petrosal nerve. Deep petrosal nerve is formed from sympathetic plexus around carotid. Nervus spinosus is a branch of which of the following? Mandibular nerve. Tympanic branch of the middle ear is derived from glossopharyngeal nerve. All extraocular muscles are supplied by the oculomotor nerve except lateral rectus. So which extraocular muscles are supplied by oculomotor? Superior rectus, inferior oblique, and medial rectus. Which of the following is not a branch of first part of maxillary artery? Greater palatine artery is not a branch of first part of maxillary artery. So which are the branches? Middle meningeal artery, deep auricular artery, and inferior alveolar artery. Which of the following doesn't elevate the larynx? Sternohyoid. And which elevate the larynx? Thyrohyoid, mylohyoid, Which part of internal carotid artery does not give any branch? Cervical. Location of piriformis fossa, laryngeal part of pharynx. Pterygopalatine ganglion supplies lacrimal gland. Preganglionic supply to submandibular gland is superior salivary nucleus. Main action of superior rectus is elevation. Superior cervical ganglia gives gray rami, communicates to C4, C3, C4. Inferior thyroid artery is related to recurrent laryngeal. Ophthalmic artery is a branch of which part of internal carotid artery? Cerebral. Common carotid artery bifurcation is at thyroid cartilage. Stylohyoid muscle is supplied by facial nerve. Deep petrosal nerve arises from plexus around internal carotid artery. Abductor of vocal cord is posterior cricoarytenoid. Opening of jaw is done by lateral pterygoid. Otic ganglion supplies parotid gland. Occipital myotome gives tongue muscles. Continuation of inner layer of choroid is pigmented layer of retina. Thyrocervical trunk is a branch of first. Passant ridge is formed by palatopharyngeus and superior constrictor. Pyramid of ear gives attachment to stapedius. Sclera is thinnest at posterior to attachment of superior rectus. Abductor of larynx is posterior cricoarytenoid. Which laryngeal cartilage is elastic? Epiglottis. Afferent component in corneal reflex is mediated by ophthalmic nerve. Bony nasal septum is formed by all except nasal spine of nasal bone. So bony nasal septum is formed by vomer, sphenoid and ethmoid. Blood supply to eustachian tube is ascending pharyngeal, middle meningeal and artery of pterygoid canal. Maxillary artery is terminal branch of external carotid. All of the following are division of the fifth cranial nerve except optic. So which are the divisions of fifth cranial nerve? Ophthalmic, mandibular and maxillary. Olfactory region in nose is above superior turbinate. Early sign of glaucoma include following except horizontal cup. So early sign of glaucoma includes nerve fiber atrophy, splinter hemorrhage and vertical cup. Lens derives its nutrition from aqueous humor. All are true about adenoids except crypta magna present. So what is true about adenoid? Physiological growth up to 6 years and present in nasopharynx and supplied by facial artery. Inferior parathyroid develops from which arch? Third arch. Which nerve is responsible for referred pain in ear? Glossopharyngeal. Sympathetic root of otic ganglion is plexus around ophthalmic artery. Soft palate is supplied by cranial accessory. Muscles of mastication are derived from first arch. Subarachnoid space ends at S2. Parotid duct opens opposite to second molar. Plica triangularis is present in antero-inferior part of tonsil. Upper border of thyroid cartilage is at C4. A patient is unable to move eye outward beyond midline. The lesion is in abducent nerve. All are paired venous sinuses except superior sagittal. So which are the paired venous sinuses? Superior petrosal, inferior petrosal and transverse. Risorius is a muscle of facial expression. Middle meningeal artery is a branch of first part of maxillary artery. Which of the following is transmitted through the foramen spinosum? Middle meningeal artery. Thyrocervical trunk is a branch of first. Which artery is palpated at the anterior border of masseter? Facial. Which artery does not contribute to Little's area? Posterior ethmoidal artery. And which artery contributes to Little area? Septal branch of facial artery, anterior ethmoidal artery and sphenopalatine artery. Which of the following is not a mixed nerve? Trochlear is not a mixed nerve. Vagus, glossopharyngeal and facial are mixed nerve. Taste sensation from anterior two-thirds of tongue is carried by chorda tympani. Pyramidal fiber are projection fiber. In the postnatal period, the greatest growth in the gray matter of the CNS is of dendritic tree. Which of the following spectrum of color is highest visualized due to central cones? Red-green. Vestibulocerebellar tract terminates in the flocculus, nodulus and uvula of cerebellum. In gray matter of cerebellum are the following nuclei: nucleus globosus, nucleus emboliformis, nucleus dentatus, nucleus fastigi. Nucleus caudatus is not in the gray matter of cerebellum. By three cerebellar peduncles, the cerebellum is attached to medulla, midbrain, and pons.